An endowment was established over 15 years ago to support an annual lecture in public health, the Nettie Baker annual lecture in public health. I came to Bowling Green State University a little over a year ago now. When I first got here, I kept hearing about the Nettie Baker, Nettie Baker, Nettie Baker, and I thought the whole time they were saying the Nutty Baker. The Nutty Baker. I thought, what is the Nutty Baker lecture? But now I know it's the Ned E. Baker lecture series. So we are building on the Nettie Baker, not the Nutty Baker, lecture series to make the symposium, and our keynote speaker is the Nettie Baker keynote speaker this morning. Dr. Baker had many contributions to the field of public health, including his work as a sanitarian, a health planner, and an educator. He served 12 years on the Wood County Board of Health, including 2 terms as president. In 1992, he was the founding member of the National Association of Local Boards of Health, or NALBO. Is NALBO's first executive director from 1995 to 1998. He established the association headquarters at that time in Bowling Green. So please join me in welcoming Dr. Ned Baker as well. Welcome. So our keynote speaker this morning is Dr. Chhs. He's our Ned E. Baker keynote speaker. Prior to taking his current position as the Senior Vice President of Safety Net Transformation and Communication Benefit at Trinity Health, could that title be a little longer? Dr. Chhs served as Chicago's Health Commissioner from 2009 until December of 2014. Working alongside Mayor Emanuel, Dr. Chhs launched Healthy Chicago in 2011, the Chicago's first comprehensive public health agenda. He led the effort to secure more than $60 million in new funding for a broad range of programs, including initiatives in obesity, tobacco, teen pregnancy, and prevention, comparative effectiveness research, and community transformation data collection. In his current position at Trinity Health, Dr. Chhs will work directly with the system's regional health ministries to focus on local safety net systems for the poor and vulnerable populations in that area. He will also oversee Trinity Health's community health ministry. Please join me in welcoming our keynote speaker, Dr. Chhs.
All right. Good morning, everybody. And thank you so much for inviting me to come in here and share with you a little bit about the fun social media stuff that we've worked on in Chicago when I served as health commissioner. I want to definitely also acknowledge Ned for his great work and great history. I got a chance to chat with him a little bit earlier ago, and his work on public health and really the push around getting the local Board of Health so engaged in transforming the health of our communities is so appreciated. So thank you. I got a chance to work with outstanding Board of Health members in Chicago over the last 5 years, and I know many local local members of Board of Health are continuing to do outstanding work. Also, it was great to meet Ben, the health commissioner of the county here, my fellow health commissioner from the area here. I hope everybody knows their health commissioner. If you don't know him, you want to raise your hand. It's always good to know your health commissioner. I figured what I'll do today is I'll just give you a little bit of a background of what we've done in Chicago using social media and why it was so important as part of our strategy as a department. I have a few slides. I have a lot of anecdotes and a lot of stuff we dealt with over the last 5 years. Since this is a social media session, here's the hashtag that if you want to use it for today's session, since we're talking about Chicago, and also my Twitter handles there for the folks who are tweeting or using social media. All right, just a little bit about Chicago and the Chicago Health Department. Let me see. All right, can you hear me okay? I just needed to be closer to be able to move the screen, or nope. All right. So a little bit about the Chicago Department of Public Health. We are one of the largest departments of public health in the country. We started back over 175, almost 180 years ago, when the Board of Health at the time was created to respond to cholera threats. And over the years, the health department there evolved to doing all kind of different things, from providing direct clinical services to inspecting restaurants to abating lead, to doing all kind of public health work. Illinois, as you know, has 102 counties, 2,731 municipalities, 912 public school districts, and 3,249 special districts. So it's a big state. But when you look in Chicago specifically, we're part of Cook County. The Chicago Department of Public Health serves over 2.7 million residents. The city is around 229 square miles. We have 77 community areas, and every community area has anywhere between 30,000 to 99,000 residents, with a median of 31,000 residents. And these community areas are so important because every community has its own characteristics, its own needs, and its own dynamics. So as we were thinking about building a healthier Chicago, we were really focused on these 77 communities as a way to help us think about how to improve the health of our community. When I was appointed as health commissioner, at that time, there was continuing to be challenges to public health. There were dwindling public health resources. Across the country, we were seeing decreases in staffing within and budgeting within local health departments. As a health department in Chicago with an infrastructure that was over 100 years old, there were all kind of challenges related to an infrastructure that is old. And anytime you try to push the envelope and create change, you have that inertia that really impedes a lot of change efforts. And then there's the political environments in public health. And I know we're going to hear from folks in the emergency preparedness and emergency management operations. When you're in a political environment, you're one agency out of many. And in Chicago, you have to be accountable to the mayor. You have to be accountable to the Board of Health. And we had 50 aldermen and 50 aldermanic staffs and more to actually be working with. And that's in addition to a lot of interest groups that are very vocal about health and public health issues. So amongst all these challenges, we had to be really effective to be able to make a difference. And as most health departments and in most public health thinking, we really think about these 10 essential services for public health. And these kind of go from assessing your health status, working on policy development, and assuring that people have access to care. And those 10 essential services are really what all public health departments focus on. And I'm sure your local health department here at Wood County focuses on all these 10 essential services. But also when, the other framework that was important for me when I started working at the health department there is to really focus on these social determinants of health. And as we look at the way to transform and improve public health and communities, it's important to think about counseling and education. It's really important to think about clinical interventions. But what's really, really makes a big difference is focusing on changing the environment, changing systems, changing policies so we can improve the health and well-being of our residents. So we spent a lot of time shifting our focus as a health department from just focusing only on individual behavior and clinical services to start thinking about policy, systems, and environmental change. And this is really important because this is where social media comes in really, really handy. And I'm going to give you a lot of example of how we use social media to really advance an agenda that's focused on policy, systems, and environmental changes. So back in 2011, after 21 plus years of Mayor Richard M. Daley in office, the mayor decided to step down. We had new election. That was the first time in over 20 years that we had a transition in mayors in Chicago. Rahm Emanuel ran for office, was elected as a mayor, and one of the very first things, actually one of the things that when he was interviewing me for the job, one of the first things that we decided to do was that we really needed to create a public health agenda for the city. And that's where the concept of Healthy Chicago came in. And the mayor made it clear that in his first 100 days of office, he wanted to release a public health agenda, and that's exactly what we've done. And in that agenda, what we have done is we've engaged local, state, and national partners and our own internal staff to think about what are our public health priorities as a city. So we wanted to do 4 things on that agenda. The first thing is we wanted to do is identify what our public health priorities are as a city. The second thing we wanted to do is set measurable targets that we'd want to achieve for each one of those priorities by 2016 and 2020 and make those targets public for better accountability. The third thing we wanted to do was to identify what are the strategies that we'd want to implement. What are the policy systems and environmental changes that we're going to put in place so we can really make a difference and help us achieve those targets and also make those public for better accountability. And the fourth thing we wanted to do out of releasing the public health agenda for the city was to really find more meaningful ways to engage our traditional public health partners, but also our non-traditional public health partners. So, we've always engaged doctors and nurses and health associations, but through that agenda, we really wanted to make sure that we're reaching out to folks that we haven't engaged before, or we haven't engaged as effectively before. So we asked ourselves, how do we engage the philanthropic community? How do we engage the faith-based community? How do we engage the tech community, the entrepreneurs? How do we engage the private equity firms? How do we engage the private sector? And you're going to see in the next few slides how we've made a very thoughtful push to engaging folks who have not traditionally engaged with public health. So that's exactly what we've done in Healthy Chicago. We've launched it in August of 2011. We've identified those 12 priorities. No surprise to anybody in this room. It's tobacco, it's obesity, it's HIV prevention, it's maternal and child health, it's violence prevention, it's healthy homes, healthy moms, access to care. No surprises there. We set those targets and we've made them public. And I think at the time, a lot of folks were a little uncomfortable. We said, we're going to get the smoking rate in Chicago to be down to 12% by 2020. This is a big commitment, and to put it public and make it public. But we thought it was important to do that. So as we started identifying those strategies that we're going to implement and these policy systems and environmental changes, we knew that a lot of them are going to be challenging the status quo. And we knew that they're not going to be all welcomed and very excited. Not everybody was going to be very excited about them. So we knew that we needed to create a movement around many of those policies that we're pushing, and we knew that social media was going to be one important way for us to really engage and build momentum and support for some of our reform agenda that we've pushed forward. So for the remainder of this presentation, I'm going to talk a little bit about some anecdotes of how we've used social media to make a difference. And I'm going to start by my 3 take-home messages that I'm hoping everybody will take home by the end of this presentation when it comes to social media. The first message is it's really, really important when you're thinking about social media to build your presence in social media before a crisis hits. And when a crisis hits, then you can use your social media as a way to mitigate the risks that might be coming through that crisis. So one first and very important message, always be in the process of building and expanding and building your brand on social media before a crisis happens. The second message is a lot of us think about social media as a way to communicate one-way stream for information. As a health department, we can pass information to the public, to our partners. But what's more important is to actively engage your audience in social media. So don't use social media as a one-way stream, but really as a both-way streams to be able to engage your residents and really also learn from your residents. So that's the second message. It's not just a one-way, it's a two-way stream. And then the third key takeaway message is think about social media as a way, take it to the next level and think about it in a way that would really help rethink the way you do your own operations. And you can't do that as public health folks alone. You have to engage folks who know how to build apps, who know how to use machine learning, who know how to use artificial intelligence to really change the way you do operations. And I'm going to spend a lot of time in the next 30 minutes talking about how we've used those partners to help us think about social media as a way to reform or rethink the way we do operations as a health department. So those are the three take-home messages, and hopefully over the next 30 minutes they'll become clear why those are important. So what I figured I'll do is I'll give you some examples of some of the policy systems, environmental changes we've put along in Chicago over the last 5 years, and how social media interfaced and was critical in advancing those. So, before I do that, I want to talk about a little paper I published with a couple of my colleagues back a couple of years ago, looking about, just trying to understand who are we tweeting to as health departments. So we did this exercise, my colleague Janine Harris and I and a couple of other folks. We went through randomly selected 59 health departments' Twitter followers, and we said, who are these Twitter followers of these local health departments? And there were around, at the time, 4,779 followers. And we evaluated who these followers are. And what we found out was most followers of local health departments were actually other organizations. There weren't individuals. And when we even dug deeper to see who these organizations are, these organizations were health-focused organizations, and they were mostly located outside the states where the local health department is. So while we always think about social media as a way to communicate to our residents, most of the followers at that time were organizations, health-focused organizations based outside of the states where the local health department is. So as you think about your message of using your social media outlets, just always it's really important to know who your followers are. But what we've learned is that the individuals who are following local health departments tend to be from that jurisdiction where the local health department is, which is really, really important, and not health focused, which is great as you think about sending your message out. All right, so let me talk a little bit about tobacco and some of the work. We've done some amazing work around tobacco. This is probably the work that I'm most proud of in my 5 years tenure in Chicago. And there are three main tobacco victories that we've had during my tenure. We've increased cigarette tax in Illinois many times during my tenure as health commissioner, including the last time was back right before I left in November of 2014. 2014. The next one was banning flavored tobacco sales around schools, and the third one is around e-cigarettes. And you're going to see why those became very, very hot social media topics. So I'm going to start with cigarette tax. I don't know, how many of you know, actually, how much is the cigarette tax in your county? Anybody knows? No. So I'm happy to tell you that in Chicago, every pack of cigarettes that's sold, every pack of cigarettes is taxed at $7.17 in tax alone. And that's combined tax of federal, state, and local. And why this is important? We usually don't like taxes. Politicians don't like taxes. The public doesn't like taxes. But this is a tax that I am extremely, extremely proud of. And you know why? Because we know, research tells us again and again, every time you increase the price of cigarettes, the packs of cigarette, more people will quit smoking and less youth will pick up that habit, especially price-sensitive consumers, and those are our youth. So during my tenure, I've seen the cigarette tax go up and up and up 3 times, and I'm very happy every time it went up. And I'm really happy to say that the cigarette tax in Chicago is the highest in the nation. And this is a tax we as a city are very proud of, or me as a former health commissioner is very proud of. So of course, when we started talking about the cigarette tax, there was a lot of media buzz around it, all over the media, not just social media, but social media was extremely important. And we started seeing a lot of people in support of the media, of the tax, but also a lot of people opposing the tax. This is probably my favorite Instagram picture with one of our residents. And I can't tell if this yellow bird Instagram user was actually being sarcastic or really excited about it, but he said, "Congratulations, Chicago. We now have the highest cigarette tax in the nation." And he has a picture of the Marlboro pack at $12.75. And if you see what you've noticed there is a lot of back and forth between this person and his followers. And that was really important for us to keep an eye on what the public is saying about the cigarette tax, and many times intervening as a local health department. And especially for folks who are very opposed to it, we had our social media team monitoring what's happening at the time and responding to folks on Instagram, on Facebook, on Twitter, and linking them directly to our talking points, our messages, to why this was important, why this is something we needed to be proud of. So it's really important to build your presence on social media, but it's really important to really engage back and forth with your residents. So if you have folks who are cheering for you, thanking them for cheering for you for that policy. And if they're not cheering for you and if you're sending wrong messages, really be able to put your message out, because we've already built our social media presence around why this tax increase is so important for our residents. The next big policy win that we've had around tobacco was around flavored tobacco. And we know, again, from research that flavored tobacco products are proven starter products for youth. We know that year after year. You know, when we banned flavored cigarettes except for menthol, Big Tobacco went around that regulations, and they started having all these flavored cigarillos, little cigars, and all kind of poison that the tobacco industry was able to create and just give it a nicer flavor. So we knew that we needed to do something about flavored tobacco. So our Board of Health was extremely engaged about this issue, felt that this is something important for us to be engaged in. They hosted town hall meetings throughout the city, including a town hall meeting in Spanish, to see and ask our residents, what do they want us to do about this important problem? Big Tobacco is selling these flavored tobacco products at a very, very cheap prices everywhere in our city, right around our schools. And what we heard loud and clear throughout these town hall meetings is these flavored tobacco products, they really simply do not belong around schools. So we went ahead and we advanced an ordinance that was adopted by the board in October of 2013 and then submitted by the mayor to city council in November 2013 and was voted to become law in Chicago, that in 2014, these flavored tobacco products, including menthol cigarettes, simply do not belong near schools. And any store that's within 500 feet of schools should not and will no longer be able to sell flavored tobacco products. So including menthol cigarettes, and this is important, and I'm going to talk to you as to why. So when we became the first jurisdiction in the country, and I think we're still the only one. I think there are a couple that have adopted similar policies since then, but we became the first jurisdiction in the country, local, state, and federal, to adopt such restriction. So we knew this was going to be an issue for many reasons. The retailer industry were not happy that we're restricting the sales of flavored tobacco around schools, and they made a big deal and saying, well, you're playing favorites, and now we as store owners around schools, we're going to be disadvantaged, and all kind of different issues. But we also knew that this was important because menthol cigarettes is really mostly used by African Americans. 75% of youth who smoke menthol. More than 50% of African American smokers smoke menthol. We know that more than 70% of the LGBT youth who smoke menthol cigarettes. So we knew that this was going to have a lot of buzz on the news and specifically on social media. So we kept a very, very close eye on what's happening on social media when it comes to that. There was a lot of support, but there was also a lot of concern, and we started seeing a little bit of issues around race and ethnicity in that debate. And we knew that this was important specifically because that menthol use among African American is much higher than the rest of the population. And we started hearing comments like, is this a racist policy? This is really not appropriate. This is not the right thing to do. So we had to be engaged in the social media to really make sure that to make our side of the story heard, that this is really was all about social justice. If we're thinking about big tobacco that are pricing the menthol cigarettes in our black neighborhoods at a lower price than they sell it in the white neighborhoods, this is a social justice issue, and that's why that policy was all about social justice. So we were really engaging the social media to respond, to engage our residents into why this was a social justice issue. And it becomes pretty dicey and pretty thorny when you start talking about race and ethnicity on social media. Probably the biggest social media engagement we've had was around our restrictions on the use of e-cigarettes in the city. I don't know how many of you here are familiar with this movement around e-cigarettes, but we knew all along that we needed to do something about e-cigarettes, and the research was developing. We didn't know how aggressive we needed to be. But we simply knew that something needs to happen around e-cigarette. And we've consulted with a lot of folks, a lot of researchers that were doing this research around e-cigarettes in the country. And we became the first city in the country, the first big city in the country, to advance an ordinance that really puts a lot of restriction on the use of e-cigarettes in our communities. So what we wanted to do out of our policy around e-cigarettes is two things and two things only. The first thing is we wanted to make sure that kids are not getting addicted to a deadly habit. And the second thing we wanted to do is we wanted to make sure that we're protecting the rights of our residents to breathe clean indoor air. Those were the only two reasons why we tackled this what turned out to be a very controversial policy in our city. You know, in Chicago, and probably in many other cities across the country, at the time we introduced this ordinance, a 14-year-old kid could walk into 7-Eleven, could grab an e-cigarette pack right around the corner from where they're selling their candy, or right next to it, could go to the cashier, buy this e-cigarette, pay for it, and get out, and nobody would ask a simple question. And this is just simply wrong. So our ordinance around e-cigarette did a few things. One, it kept e-cigarettes behind the counter. So no longer kids could go in and be able to grab those e-cigarettes right from the candy aisle. So we made sure that these e-cigarettes are behind the counter. We required that you cannot sell e-cigarettes to minors, so you have to be 18 or older to buy e-cigarettes. And we also required the retailers that are selling e-cigarettes to have a tobacco license. And this is important because we do sting operations on tobacco retailers, and if they're selling cigarettes to youth, then we can find them, revoke their license, give them all kind of trouble. And then the other thing that we've done is we realized that, these e-cigarettes that are coming in bubblegum flavor and cotton candy and atomic fireball flavor and all that type of stuff, those were not targeted for us. Those were really made to target to youth. So we said, again, like with flavored tobacco, if you have a flavored e-cigarette, you cannot sell flavored e-cigarettes around school. And then the other thing that we've done that turned out to be extremely controversial is we said simply, in places where you cannot smoke your regular cigarettes, you're not going to be allowed to vape your e-cigarettes. And that became a really, really big issue because a lot of people felt that this was not right, and people felt that they do have the right to vape their e-cigarettes right around patients and in hospitals or in libraries or in movie theaters. And we just simply felt that until we don't have enough evidence to prove it's safe, and until we know it's safe, we just simply do no harm. So we advanced this ordinance, and we thought that it was going to pass without a lot of controversy, or we actually knew it's going to be controversial, but we didn't expect the resistance that we've seen to passing this ordinance. So this is actually now the signs that you see everywhere in Chicago if you go, because we've added the e-cigarette to that ordinance. So when we advanced this ordinance, it was covered all over the media. We were the first city the first big city in the country to introduce this ordinance. We then coordinated with San Francisco, New York, and Philadelphia to actually advance similar ordinances and get the implementation date of these ordinances on the same time. So LA, New York, San Francisco, and Chicago implemented that same ordinance in April of last year, and it became national news because all of a sudden you have the same ordinance being implemented in the three largest cities in the country, impacting 17 million people, and now it becomes the trend. Everybody that's trying to introduce an e-cigarette ordinance, it includes very similar items to what we've included in that very original e-cigarette ordinance that we've introduced in Chicago. So by getting this national attention on this, the day of the vote of City Council, we were getting Twitter bombed. I don't know how many of you know what Twitter bombing is, but what we've realized, I actually published a paper with some of my colleagues there about astroturfing and Twitter bombing, because we've noticed that that day, our social media, it was a crisis day for a lot of people, for the e-cigarette fans who were really not happy about the ordinance, and also for us, because we were getting literally tons and tons and tons of tweets bombarding our Twitter handle, bombarding our Facebook page with messages opposing that ordinance, to a point where we thought, well, maybe there is a lot of opposition. Maybe this is, we need to think through this a little bit more. And not only we as a local health department, we were getting the hundreds of tweets and thousands of tweets. Aldermen who are supposed to be voting in favor or against that ordinance were getting the same type of messages. We ended up passing the ordinance 44 with the 5 opposed. So we passed this ordinance really, really solidly. But those aldermen got a lot of tweets and a lot of messages on their Facebook, to a point where they were wondering, and I had many conversations with many of them, saying there's really a lot of opposition to this ordinance. So I said, something is just not right there. And I was going to analyze this and try to understand what's happening there. So my colleague, again, Janine Harris, and I, and a couple of other folks, we went and said, okay, what's happening there? Let's look at all those tweets. And we, kind of looked at the timeline of all the tweets that came out in favor and opposed to the ordinance. We tracked them, we analyzed them. And what we learned through this process was 89% of the tweets that came out were opposed to the policy. So when you see that, you'd think, oh, there's a lot of lack of support for this policy. Why are we advancing this policy? Even a third of these tweets were bashing us. They're saying the health department is lying, the health department is disseminating wrong information, all kind of stuff. So when we analyzed those tweets a little bit further, we've realized that 14% of those tweets were actually coming from accounts consistent with what we call astroturfing. And astroturfing is a term that basically you look at these accounts and you try to see what kind of characteristics they have. And they might have characteristics like they're new accounts, they're accounts with very few followers, they're usually accounts from out of town from where you are, they're accounts that are using links to the same article, but they changed the link, the shortened link, the shortened URL on that tweet. So those are characteristics of tweets and accounts that are created specifically to give a false sense of consensus around a policy. So when we looked at these policies, at those tweets, they were coming in one way, shape, or form related to one of the agencies that were fighting that policy. And when you dig deep, many of those accounts really were not true accounts. So it's really important, as you think about how people are responding to your social media, try to see who these folks are that are really pretending to be against your policy that you're trying to advance. And what we also noticed is that as more and more of these conversations are advancing these ordinances across the country happened, that Twitter bombing, that astroturfing became much more advanced. So our debate happened at City Council. We passed the ordinance. The next was actually LA, and LA County, the LA City Council saw even more of that social media engagement that has very similar types of characteristics to what we've seen in Chicago when we advanced this policy. So again, a lot of lessons learned through that process. I'm going to talk about a couple of other policies we've done that also garnered a lot of attention, but we also used it as a way to help build our social media presence. Many of local institutions became tobacco-free. It got a lot of positive media coverage, including on social media. The University of Illinois became the latest of the higher education institution to adopt tobacco-free campus policies. I'm going to make a plug. I don't know if Bowling Green State University is tobacco-free or not. If it is not, I really encourage all of you here to start creating a movement to make the campus tobacco-free policy. We used social media as a way to engage students and faculty at the University of Illinois to really create that movement, to create that task force that was reporting to the chancellor that actually turned the University of Illinois to become a tobacco-free campus policy. And we've done the same with many other campuses as well. And we've also worked with the Chicago Housing Authority. 55,000 residents in Chicago depend on the city government and Chicago Housing Authority for housing. So we spent a lot of time working with the Housing Authority to adopt tobacco-free tobacco-free housing policies. And now we have many of our housing, public housing, becoming tobacco-free. And this also got a lot of social media and regular media attention throughout the process. Another one where we've gotten a lot of social media coverage and engagement around our smoke-free parks. And I don't know if your parks here are smoke-free or not, but we wanted to make sure that we're creating that same type of, expanding the environment where people can enjoy the spaces tobacco-free. So just most recently, we passed this ordinance that made all of our parks tobacco-free. We have 580 parks in Chicago, 90 gardens, 90 museum campuses, 9 lakefront harbors, 9 ice skating rinks, and actually now 11 with the new park that we just opened. More than 24 miles of lakefront property, including 17 historic lagoons, became all of a sudden tobacco-free. And that was really, again, as part of our movement to create more and more smoke-free environments in our city. And when we did this, we figured we're not the first jurisdiction in the country to adopt tobacco-free parks. So we thought it will be, nice. We'll get some coverage. Well, it got, the front page of our Red Eye, the Chicago Tribune paper that morning was covering it, and we started seeing a lot of social media engagement there. And some were positive, but many were not very positive. And again, when we looked at the not so positive, it's just, it just was a way for us to engage those folks and really connect them into our talking points, our messages, our reasoning as to why this is important. The other thing we've done is we've really pushed the envelope when it comes to tobacco and using marketing messages. And the ad campaign that you're seeing, the Burned ad campaign, got a lot of coverage. And again, this was a lot of target on menthol cigarettes. I'm not familiar with any other local health departments or any other campaigns in big cities around specifically raising awareness about menthol cigarettes. And we really targeted the African American community at that time because we knew that big tobacco was manipulating the prices of menthol cigarettes in the black neighborhoods, and we needed to raise awareness of that issue in the black community. So we were pretty provocative in our ad campaigns there, got tons and tons of coverage there. The other also ad campaign that got a lot of coverage was our ad campaign targeting black lesbians in our city, because we knew from research in our city that actually black lesbians smoke at a much higher rate than the rest of the community. So we did ad campaigns that really target this community. And in our approach and thinking about ad campaigns, we know there's a lot of clutter out there for ads. So we needed to be able to cut through the clutter and have our messages stick out. So that's why many of our ad campaigns were controversial, Most got positive coverage, some didn't get positive coverage, but that was an okay risk we were willing to take to get that message out there. So both of these ad campaigns got a lot of coverage, a lot of activity, not on the traditional media, but also on mostly on social media. Another policy that we've done that also got a lot of coverage was our policy to change what's offered in vending machines in city buildings and really challenging the private sector to pull out all of the junk from your vending machines and sell healthy items in your vending machines and really pull out the sugary drinks from your vending machines and have healthier replacements there. And we pulled all vending machines from schools. We pulled all unhealthy items, snacks, and beverages from the parks, and we only replaced them with healthy snacks and healthy beverages and the snacks. Every city building, and we have over 300 of those, pulled most of their unhealthy items from their vending machines and replaced them with healthy items. Tons of coverage there. And when we challenged the private sector, we went to social media and used social media as a way to challenge the private sector to help us adopt those similar standards that we've adopted as a city. Got also a lot of coverage. Another policy that got tons of coverage as well is really rethinking the way we think about transportation. And when you think about streets, immediately the first thing that comes to mind usually are cars. And streets are built for cars. But we worked with our transportation department and we came up with a different hierarchy. Sure, streets are built so that cars can drive on them, but the most important customer of your streets are pedestrians. So let's think about that when we're resurfacing our streets, when we're building new streets, by putting pedestrian first, putting public transit next, bicycles third, and then auto and trucks as the last and that hierarchy. So when we started talking about this concept, it made perfect sense to me, but I'm in public health. But this didn't turn out to be, as exciting to a lot of people, because we actually took it, it wasn't just a policy that we've developed. We actually changed things to make it happen. I don't know how many of you have been to Chicago and the Central Business District in Chicago. Dearborn is one of the main streets that cuts through the Central Business District. And I would challenge you to find any major city in the country that takes one full car lane in the heart of your Central Business District, eliminate this car lane, and turn it into a two-way bike lane in the heart of the Central Business District. So think about all kind of excitement about this. We wanted to make sure that people know that Chicago is serious about creating a safer and more bike-friendly environment. We wanted commuters who want to consider using their bikes to come to work in Chicago to feel safe biking in the Central Business District. So we literally took that whole bike lane, that whole car lane, turn it into a two-way bike lane, and not only two-way bike lane, but it was a protected bike lane. So we put barriers to separate the cars from the bikers so that bikers can feel even more safe when they're biking into the city of Chicago Central Business District. The pictures there is one is before the transition, the next is after the transition. I think you can see the poor biker on the left side trying to kind of manipulate in the HOV lane right next to the bus and all these other cars. On the second picture, you'll see after the transformation. This one got tons and tons and tons and tons of positive social media coverage. And you know why? Because the bikers community, they're very vocal on social media. Very, very vocal. It was tons of positive coverage on traditional media, but on traditional media we had some of the car drivers that were not happy, but in general, on social media, got tons and tons of positive coverage. And then we also did the bike sharing program, and I'm assuming you guys are all familiar with these bike sharing programs. We have one of the largest in the country. We have 300 bike stations, 3,000 bikes spread throughout the whole city, where you can just hop on one bike, get to the next station, drop your bike at the next station, and then go do your work. This Divvy bike bike share program has been tremendously positively successful. Very positive feedback on those. We literally have millions of miles used, and we do all kind of fun stuff on social media with bikes. So, for example, this is these. If you've been in Chicago, I'm sure you've seen those bikes throughout the city. But we have one red bike. They're all blue bikes, kind of the color of our city. But we have one red bike, and we challenge folks on social media, if you happen to bump into the red Divi bike, just take a selfie with it or take a picture and tweet it. Those tweets are coming along all the time. So again, a way to create the buzz around your public health initiative. The other thing we've done also from a policy perspective that garnered a lot of attention was some of our changes that we've done at the Chicago Public Schools, food policies. So think for a minute about the Chicago Public School. 404,000 students go every day to the Chicago Public Schools. 88% of those students depend on the Chicago Public Schools for 2 meals a day, breakfast and lunch. Those 88% live below the federal poverty limit, so they qualify for free and reduced lunch meals. The Chicago Public Schools serve 75 million meals every year. 75 million meals every year. So one of the things that we've done as a city, we're like, if those students, these 404,000 students depend on us for 2 meals a day, let's make sure that the food they're eating in school is healthy food. So we pulled all fried food out. We reduced significantly the amount of sodium that's offered. We made sure there's a fruit and vegetable in their meal. There's salads in every one of those meals. That got a lot of coverage. Mostly positive, but some was not so positive. For the first year after we've done the transition, the students are like, we don't want to eat this. We want our nachos back. We want our, fried chicken back. We want all of this other stuff back. But we persisted because we knew that if we create that healthier environment where the students could eat healthier in the school, that hopefully will allow us to have a healthier generation. So got tons of coverage, local, traditional media, but also on social media. Probably the one that was that got a lot more coverage, that was a little bit more edgy, was around the celebration policy for the Chicago Public School. And we circulated different types of policies around how can we celebrate birthdays and other stuff at the Chicago Public School. And we have different levels of those policies, from very, very tight on what you could serve in celebrations to kind of somewhere in the middle. And for a while we were thinking, well, do we really want kids to be celebrating their birthdays with like cupcakes and stuff that are not healthy? And when we floated the idea, we started noticing a lot of pushback against that, including things like, here comes the cupcake Nazis or all that type of stuff. So we kept an eye on that one, and it actually helped. The response to that, floating that idea, helped shape that policy a little bit different, and we weren't as strict as I would have liked us to be at the end because of a lot of the feedback that we have gotten. Other stuff where we found social media to be tremendously helpful in advancing public health was around enrollment in the Affordable Care Act. And in Illinois, we embraced the Affordable Care Act, where we were really excited about it. We wanted to make sure that more and more of our residents have access to insurance. And so we did very aggressively target our uninsured and let them know what their opportunities are and how can they benefit from those opportunities. Right before I left Chicago, we had over 175,000 residents who were previously uninsured now have access to expanded Medicaid. We have over 75,000 residents who were previously uninsured now have access to the marketplace. This is something we embraced, and we wanted to make sure that our residents have access to insurance because we strongly believe that healthcare is a human right. So as part of that process, we really needed to make sure that we're engaging communities that have not traditionally interfaced that well with the health system. And one of those were the artist community. So when we know that artists don't have insurance as much as the rest of the population. So we've used social media to really create and incentivize artists and invite them to events specifically for artists to enroll them in insurance, and that was very positive. We've also targeted our interventions to taxi drivers because we know a good number of our taxi drivers are immigrants in the city of Chicago, and the immigrant community is very hard to reach out to. So we use the taxi drivers as a way when they're coming in to renew their license or to sign up for license and to get education through our city government. We have agents who are enrolling the taxi drivers right on site, and that was really our way to get into many of the immigrant communities. So we're enrolling not just the taxi drivers, but their families, their friends. That also got a lot of buzz on social media and really helped us spread the word on that. This is probably our most successful ad campaign, and this was around our adolescent health initiative. And you know, this might not be a crisis in the traditional sense, but our teen birth rate in the city was 1.5 times higher than the rest of the country, and we knew that we needed to do something about that. Teen birth is such an important public health issue. You know, we know that teen babies are more likely, babies born to teen moms are more likely to be born premature, more likely to have low birth weight. The sons of teen moms are twice as likely to end up in jail. The daughters of teen moms are 3 times as likely to end up being teen moms themselves. It was, in my mind, this is a crisis. We can, you know, it might not be an Ebola crisis, it might not be a tornado crisis, but this is a public health crisis. So we knew that we needed to be very focused on teen pregnancy. So we pushed this ad campaign, and we knew it was going to be controversial. You know, people don't expect to see pregnant teen boys on big billboard in the city of Chicago or on bus stops. And we only had $36,000 to spend on this ad. So we partnered with an ad agency, developed these ads, and placed them in few places in Chicago. And we thought that this is just going to start the conversation, because people did not expect to see pregnant teen boys on billboards. But it starts the conversation about a very, very important issue. Well, guess what? This $36,000 ad campaign turned out to be over 1 billion impressions all over the world. It got covered on Good Morning America, on Today's Show. It got covered on Wendy Williams, Access Hollywood. We were doing interviews in Japan, Australia, France, Britain, Colombia, the country. It was an outstanding coverage on this. And all what it was just to start that conversation. Social media was a huge and really advancing this message. This became our most retweeted tweet in 2013. This became our most viral Facebook message that year. So it's really important to think about crisis in a different ways and using social media as a way to amplify your message. And then all of a sudden we started noticing that now we're engaging our residents in a different way. We're doing Twitter chats talking about, you know, STIs. We're participating in panels and social media weeks. So this was really important for us that first important lessons is build your social media presence before a crisis hits. And the way to and make sure the second lesson is to really engage your residents, respond, learn from your residents, really respond to them. So those were the 2 really key important messages that we've learned. So when a traditional public health crisis comes in, you have already built your presence, you've built your brand. You know, a traditional public health crisis, you know, when we're talking about the flu, you know, these are some of our flu ads that we've used in Chicago in 1918. This is one of our very first flu ads in the city that I was able to go through and find. In 1976, we had the same thing. You know, this past year, we focused on our athletes to kind of, you know, encourage people to get their flu shots. But what we've noticed is when we were having the peak, the most peak in the flu season last year, we hosted a Twitter chat. Even the mayor had a question on that Twitter chat, and he wanted to see, you know, can he still shake a lot of hands when we were having the highest peak of our flu season in Chicago. It had 302,000 impressions, this one very small, quick Twitter chat that we've done. And then we've realized that we needed to be more engaged in using social media, but also driving people to something actionable. So we partnered in one of our open government hack nights, and we partnered with an app developer. He developed an app for us to, so we can drive people to, on social media or traditional media, if they want to know how and where they can get a flu shot, whether it's free or they'll pay for it, they can just simply do it. And that's exactly what happens. You click on that app, launch it, it knows exactly where you're at, and it gives you the closest location where you can get a flu shot. If you want to pay for it or not, you can get access to the free flu shots. That app became so popular that it was used thousands of times in Chicago, and then that same code was used in Philadelphia. They simply changed where the location is. So, now they have Philadelphia locations that was used, the same app, the same code was used in San Francisco. So it really, again, it helps rethink the way we've done flu emergencies all through as a health department from, 1918 or even before that. But this is the new way of thinking about that. In Chicago, we have cold weather, and we use social media regularly to interface with our residents, to give tips, to tell people where to go in case they don't have access if something happens to their heaters or something like that. So we really engage around weather. The same thing goes to heat waves. We have those as well. And what we've realized in that active engagement, your followers become your best advocates in amplifying your messages. So it's no longer just the Chicago Department of Public Health sending a message, but it's Caroline Weiser, who's this resident in our city, who says, oh, this is important. I need to send this to my colleagues too, and my friends and my family. Ebola is probably the most recent crisis where we use social media very, very regularly. You might still remember Chicago O'Hare was one of the 5 airports where we were doing screenings. And believe me, for 2 months, right before I stepped down as the health commissioner, that was my life. It was all about Ebola. It was all about the screenings that are happening at O'Hare. We had 2 flights coming in through Europe, but from Africa every day at 1:15 and 1:45 in the afternoon. And guess what? Every morning, the first question is, how many people do we have coming from those 3 countries impacted in West Africa to Chicago? Because I knew it was going to be, if we have more people, it's more likely that somebody might screen positive. And we have seen many people screening positive for signs and symptoms. Nobody ended up having Ebola that's coming through O'Hare, which was great. But think about the hype and the coverage that you would get every time we had to isolate somebody or in quarantine folks coming in from West Africa, from these 4 countries or 3 countries in West Africa into the city and transport them from O'Hare to one of our Ebola network hospitals. It was all over the news. So we use social media very aggressively and regularly to address some of the issues there, and really provide a lot of education and eliminate some of the fear. Monkeypox is probably one of my, kind of most fun stories to tell. So one day, we were just talking, there's no dull moments in local health departments, and one day we get a call from the CDC telling us, well, there's a plane that's coming from London. It's going to land in the next 30 minutes or so at one of your airports. And there's a person on that plane who contacted her mother to say she thinks she has monkeypox. And, we're going to be working with you. You're going to need to address this issue. And of course, we have a very active emergency preparedness team, and we engaged our Office of Emergency Management. We had that plane ready to be quarantined the moment it lands at Midway, and all of that. And we were activating everything, and I'm really trying to learn about monkeypox. I don't know how many of you, I haven't heard about monkeypox for years. I'm not an infectious disease specialist, and I'm trying to learn all about monkeypox. Our infectious disease specialists are all over it. And then literally within the moment this plane lands, and 5 minutes later, we get a call from CNN saying, we'd like to hear about monkeypox. What's going on with monkeypox? And I'm like, how did CNN knows? Well, it turns out that people on the plane with that lady were taking pictures and tweeting them out and saying, we're being quarantined at Midway Airport in Chicago because we have a person with us on the plane who has monkeypox. So all of a sudden, this became national news on CNN, ABC, CBS, and all of us trying to kind of do the right thing, but at the same time responding to a huge amount of media calls and coverage. And so one of the things that we've done was really, our social media team really spent some time going through it. Of course, it turns out that the lady just has simple rash, nothing to do with monkeypox, but we wanted to make sure that we're responding to the media. We've engaged people and we put talking points, messaging on our website. We started responding to people back to let them know that, no, this is not monkeypox, here's the right message, to a point where this guy, Adam Plotkin, was really not happy with our direct response. And he's like, well, I'm going to start doing something so that the health department doesn't know that I'm saying. But we were really listening to him too. The last piece that I'm going to cover is around app development, and specifically around our foodborne chai app. And this is really the third lesson, the third message the take-home message, is we have to engage when we're thinking about social media. We have to think beyond just public health folks. We needed to engage the civic tech community. In Chicago, we've engaged many other people in the tech community to help us use social media in a way to rethink the way we do our business. So we've done multiple efforts, including the development of a Chicago Health Atlas, where people can do all kind of fun stuff to learn about the city. We've liberated a lot of our data. There's really no reason why we were hogging a lot of our data sets within the health department. We posted these sets online, and then these data sets online, and then all of a sudden, you have now the tech community saying, hey, we can use these data sets and develop apps and do all kind of fun stuff. So we've developed all kind of apps. The flu shot finder app, the back to school campaign app. We have a condom finder app. At first, we thought it was going to be mostly targeted to youth, and guess what? We realized that actually more and more older people were using that app to find where they can get free condoms in the city of Chicago. But probably the one that got the most, the one that was, in my mind, the most innovative was around foodborne Chicago. So foodborne chai, this is a little bit more about some of our apps. When you think about food poisoning, the majority of food poisoning never gets reported to the local health department. People go eat out, get sick, never report it. They usually recover. Some go to the emergency room, but they never really report it to the department. But in reality, what we've seen is that, and we have 15,000 food establishments in Chicago, so this is a big deal for us. So while we know that people might not be calling us to let us know they got food poisoning, we've realized that many people go to Twitter and say, oh, like this woman here, or man, this woman, she says, well, food poisoning sucks, and she actually takes a picture from the emergency department with the IV in her arm. So could we find a way to use social media, to use those tweets to respond to a public health threat for that person? And could we respond to that food poisoning case? And then we started noticing that actually there are a lot more tweets. So no happy tweets today, just have food poisoning. This guy, Jordan, this girl, Jordan. This is another, yep, doctor said I had food poisoning. All those are tweets that are coming out of Chicago. This person, I had a horrible stomach pains, and the doctor said it was food poisoning. Food poisoning is never eating Chinese again, and I hate this hospital. I'm back after 5 days of having what my doctor says is a stomach virus, food poisoning from eating at Illuminati's in Lincoln Park. So this is a tweet that actually is saying, I ate at that restaurant and I got sick. And now, please don't tell me you not want to eat there. It's actually one of my favorite pizza places. So what we said, well, is there a way that we could track those tweets, sift through the tens of thousands of tweets that are coming out of Chicago every day, through machine learning, identify those tweets, and then act on them? So here's exactly what we've done. So we developed this app that sifts through those tweets. If we see a tweet that might be related to somebody getting sick from eating out, we respond to those folks and say, hey, we're sorry you're feeling sick today. If you answer those 4 questions, we will send an inspector to do an inspection at that restaurant. And guess what? 87% of people we respond to They click on those 4 questions, answer these 4 questions, and then we get the information so that our sanitarians can go and do an inspection. We do an investigation, and guess what else we do? We post the result of the inspection online, and we go back to this person 3 days later and say, hey, we hope you're feeling better. Click here to see what happened as a result of your complaint, and see what happened as a result of that inspection of that restaurant. So this is the 4 questions that we asked, simple questions. And then we monitored this. We implemented it and we monitored it for a year. And what we found out is that this is kind of the results of the inspection that we post online. And what we found out is out of 137 inspection, 127 food establishments had violation in them. And we monitored those violations compared to inspections that we do randomly. And we found out that the critical and serious violations, and I know Ned probably still remember those different layers of types of violations that could cause serious illness, 25% more temperature violations that are extremely critical and serious violations when it comes to potentially causing food illness. This is, you'll see the critical violations and the serious violation. So this types of using partners in the private and tech sector to help you use social media to address a public health threat is something extremely important, and is the third take-home message that I advise you and I really encourage you to think about. This app got tons and tons and tons of coverage, as you can imagine. My favorite is, people saying this was my most memorable tweet. We tweet all the time, or people who tweet all the time. But for many of those people who tweet and they have their health department respond to them and do something about that tweet, and do an inspection and then come back to them, this is really the way engagement and government should be responding to its resident. We got it covered. We wrote a paper about this with a couple of my colleagues also. It was published in the MMWR. Got tons and tons of coverage, not just local, but also national news. And one key thing also to remember is when we developed these tools, we made them available to the public as well. So all these app codes and all of this, we put them on GitHub so that other other health departments, other public health agencies, if they want to use these codes, they don't have to recreate them. We created them. A lot of them were created for free through volunteers and through the app community or the hack community or the tech community, whatever you'd want to call them, but we make them available for others. So those were my 3 take-home messages, and I think we'll have probably 10 minutes for questions and answers. So make sure you build your social media presence and your brand before there is a crisis. The second thing is you have to use your social media as a 2-way communication, not just one way to send information out. Use it as a way to engage your resident before, during, and after a crisis. And the third take-home message is really engage the tech community to help you take social media to the next level to change the way you do operations. So I'm very proud of my last 5 years at the health department. I couldn't have done it without an outstanding team at the health department, outstanding team at city government, outstanding mayor, and really great partners throughout the city and across. And I do want to brag about my former employer. We were named the local health department of the year back in 2014, and that was a great way for me to end my 5-year tenure there. So thank you so much, and I'll take a few minutes of questions before the panel, my esteemed panelists, join me. I think we have 5 minutes for questions, and don't be shy. Go ahead. So we had one person whose main job was on social media, but it was really our communications team. Everybody was active on social media. It was part of my job, part of everybody's job to really be active on social media. And there was a shift in culture, when through the transition from Mayor Daley to Mayor Emanuel, because at the Mayor Emanuel's office, they created a social media team for the whole city. It really allowed us to be much more creative, and it opened the door to kind of push the envelope on social media. Yes?
I noticed how you had mentioned about posting text on
Yeah. So this is not just in Chicago. I mean, research year after year after year shows that every time you increase the pack of cigarette by $1, the smoking rate will go down by 4 to 5%, and youth smoking pickup will go down because the youth, kids are the most price-sensitive consumer, and every time you increase the pack of cigarette by $1, youth are less likely to pick up that habit. It's very, very well known. In reality, it takes political will to raise any kind of taxes. One of the ways that we've done it that was really helpful in Chicago is the commitment that the dollars we're going to make as a result of that tax increase, we're going to go to support public health initiative. And that was a great way to really create the support, the political support for the cigarette tax. So we've used a lot of the money that came up as an added bonus because of that tax to create a vision exam screening programs at the Chicago Public Schools to make sure that our kids who don't have insurance in the schools are getting enrolled and expanded in Medicaid. So if you use these dollars to support public health initiatives, it becomes more likely to be palatable. But at the end of the day, it is a tax increase, and politicians don't like taxes. So simply. Any other questions? All right. Well, I look forward to the conversation with the rest of the panelists. They're going to bring outstanding backgrounds and experiences to this discussion. Thank you so much.